Dr. Jonas Apostol. So let's talk about the cons first, okay? Number one, there is a tooth preparation that we call. We have to shave off the teeth in a minimal way. It's minimally invasive procedure for some cases, but when we see like cavity, then the preparation will become bigger, okay? Because we don't allow any unsound structure to left behind, because it will proliferate, it will damage the teeth in the future if we leave it there. Ideal veneer preparation, it's minimally invasive. We don't need to remove a lot as compared to a crown. So number one, it's teeth preparation. In my own practice, there is no such thing as no prep veneer because we have to do a bit of preparation. Sometimes it's minimally invasive wherein we remove a small portion of enamel just for the margin to be established so that the teeth would not look bulky. So we have our own protocol there. The teeth preparation, we have to remove a portion of teeth, especially on the facial area and incisal. But sometimes we have to extend it. It depends if there are presence of any cavities or unsound structure. With veneers, we are saving a lot of enamel and tooth structure as well. At the end of the day, we have to do a teeth preparation for a veneer. So second cons, it's irreversible. Okay, when we remove certain portion of enamel, we cannot grow back the enamel. Okay, so once we did it, it's done. It will be the same and it will never regenerate. Our enamel is made up of hydroxyapatite crystal, which is inorganic by nature, and it will never grow back. It's not like your nails that once you cut it, it will always grow back in your hair or something like that. Once you lose your enamel, yun na yun. Number three, it's expensive. Okay, most of the veneer restorations are expensive, especially when we use indirect porcelain or zirconia material. Fourth, sensitivity. Because we are going to remove portion of your enamel, there's a tendency that your teeth will become sensitive. But not often. Not all cases will experience sensitive teeth. So it really depends. Right? Fifth, chipping off. There is a tendency that your veneer will chip off. It depends on the number one, thickness. Okay? And the design also could be a factor. But don't get me wrong, even your natural teeth can crack. Okay? That's why you have to take care of your veneers. For the porcelain is delicate, but yet it's durable if it's taken care of. Now let's move on to the pros. Okay? What are the reasons why we have to get or we want to get these veneers now? Number one, it will give you confidence. It will boost your confidence to the next level. If your problem is your teeth and you can't smile, then veneers would be for you. Could really add value to your life. So number two, it can whiten your teeth. We can be able to change the color, the size, and the shape in which it can enhance the appearance of your full smile. Not just that, it can also influence your face. So if you have a nice set of teeth, it can make your face brighter as well and change some aura. Number three, veneers can also act as an anti-aging solution because sometimes, as we age, our collagen tends to lose.
Part of the aging process of our skin is that we lose collagen over time. And this can start in the early 30s and even in the late 20s, where every year you lose more and more collagen.
The teeth are less visible, so if we put something in there like veneers to add volume, then it can really change the way you see yourself, not just inside but also from the outside appearance. It's because of that volume, it can create some illusion that would make you a 10-year younger than your actual age. Okay, for some cases, veneers can correct your speech, and also it can correct some bite issues. So when you have problems with your bite, or what we call a parafunctional contacts, it can actually progress and develop into like speech impediment that would be very challenging. But yet, for some cases, we can be able to correct it with veneers, like doing some proper distribution of loads and removing all those interferences and those abnormal bites. In that way, we can be able to enhance not just the appearance but also the functionality and also the health of not just the teeth but also the bones, the muscles that holds, and also the TMJ. So lastly, a brighter smile means a brighter future. When you're happy with your teeth and your smile and you don't have any insecurities about it, and you have addressed all the problems that has been causing you any anxiety, it means it's a great deal. Why? Because it will catapult you to the next level. That's why we are here, to help you achieve those dream smile. But it's not just that. We don't stop from giving you beautiful smile, but also healthy and functional. Okay, so you have to be committed with the veneers. If you decide to have veneers, you have to take care of your oral health, because once you have veneers on, there is also a tendency that it will decay inside if you do not take care of it properly. That's why we are encouraging all our patients to brush your teeth and floss it as if it's like their normal teeth, because there would always be a possibility that the teeth can change in the future. And also, there is a possibility that we have to redo it. So with the color of your teeth, it doesn't mean that we are giving you the whitest shade possible. There are a lot of choices, and we have to make a choice according to what is best for you. When choosing the color of your teeth, we are also considering the skin tone of the patient. We're also considering the color of the eye and also the personality and the numbers of veneers to be placed in. Okay, because we don't want to put some super white teeth and then it will not blend in with other virgin teeth. So we have to consider all these factors. So when it comes to the design, we have a lot of designs available. So you have to talk to your dentist heart to heart what you think is good for you. But at the end of the day, your dentist has the eye and the skills to make these design possible, because sometimes we want a certain design that is very beautiful but is not perfect for your face. Our facial structure sometimes is different. That's why we have different designs like bunny, Hollywood design, or something that more dominant canine. So your dentist could guide you through the design that is suitable for you. So a good communication with your cosmetic dentist would be the best way for you to achieve that perfect design. Okay, with veneers, we have to consider the adjustment period. It doesn't mean that after we cement the veneers permanently, it will become like as if it's your normal teeth na nandun lang siya. Because we change the size, the shape, and the design of your teeth, then you have to expect that a certain duration, for some a week, for some months, to be able to adapt to the new design properly, design veneers. But after some time, everything will blend in, and even your lips can't be able to identify that it is a veneer because it has adapted.